We have Dr. Anil Elhence and he is practicing in Meerut. Well, today we're going to be talking about a very pertaining, very important problem, that is OAB. So, very welcome.
Thank you.
Well, can you please describe for the audience viewing this, what is the definition of OAB? What is it? Because there are people who don't know what is an OAB.
OAB is a short form for something known as overactive bladder.
Yeah.
And our urinary bladder for 98% of the day is a storage organ.
Yeah.
Where it stores urine, and that is why we all remain dry most of the time. And our kidneys are constantly producing urine, which comes down to the bladder and stored there. And once the bladder is full, we get a signal to our brain gets a signal. We go to an appropriate place and relieve ourselves. So this is what a normal bladder is. In overactive bladder, as it implies, the bladder is overactive, so the storage capacity is reduced, and the patient is unable to hold urine to the desired length. A normal person would hold, say, about 300 to 400 ml of urine. So at a good intake, I mean when he's taking good amount of fluids and normal diet, will produce 60 ml of urine per hour. So 300 means 4 to 5 hours. So every 4-5 hours, that's what a normal person does, goes and passes urine. So in overactive bladder, the person passes urine much frequently because the bladder is unable to hold on to 300-400 ml. So you will have a desire to pass urine at lesser volumes, and once the desire comes, it becomes overwhelming. Yeah, he or she has to rush, and at times might even wet himself or herself and become incontinent. So this is what overactive bladder is.
How does it impact the quality of a life of a person?
Overactive bladder impacts the quality of life to a very, very large extent, and it is basically a quality of life issue, especially for a professional, someone who's working. So he has to interrupt his work and has to visit the washrooms frequently, and at times when he has to rush to the washroom and may even embarrass himself by soiling herself or himself. And for a busy professional like a doctor, lawyer, judge, or just about anyone, even an anchor, who is during the course of an interview has to get up and rush to the washroom, it's pretty embarrassing. And quality of life, and what it makes the person do is become a recluse. He or she would not go socially out, will not interact, because and anywhere he or she goes would be always on the lookout for a
it
washroom.
It is uncontrollable.
It becomes uncontrollable, and you're always on the lookout for a washroom. You don't want to wish to travel, you don't want to go out, so it's a huge quality of life.
Well, what could be the consequences of delayed diagnosis, to be precise, if he's delaying or she's delaying?
Delayed diagnosis is basically troubling himself or herself all this while, and usually it's not as if men don't suffer, but in women what happens is that somehow anything related to the lower end of the body, the women tend to go to a lady doctor, a gynecologist, and they are mistreated like infection.
Yeah.
And they keep getting all kinds of antibiotics without any success, and then they think, and some of their peers will tell them, well, this is what a woman's life is all about, and they tend to suffer in silence, which is pathetic because the cure is so easy.
Well, the awareness is needed.
Yes, of course.
Well, what is your advice to the individual who are suffering from OAB?
So, if someone has OAB, he or she would be passing urine more frequently, so the frequency is more. A normal person should be passing urine 6 to 7 times during 24 hours. Of course, if he or she is taking a lot of fluids for whatever reason, obviously the number will be more. But if someone notices that his or her frequency is more, and once the desire is there, it becomes an uncontrollable desire most of the times. At times, all of us can have an occasional time when we have delayed for some reason, and then it becomes very difficult to hold on, but we're still able to do it. So if the desire usually becomes uncontrollable, and at times you wet yourself, then it's about time to seek help and visit your nearest friendly urologist.
That's the extreme condition.
No,
leaking
is one of the part of that syndrome. It's not exactly so we can have a wet OAB, we can have a dry OAB.
Okay.
So the both kinds of OAB. So obviously a wet OAB becomes more of a social embarrassment because, but then the amount of leakage could also be variable. So if it's a very small leak, so people still tend to live with it.
All right. So we have heard of the term which is called behavioral therapy. How does that work and what is it?
Any patient who's being treated for OAB would require, it begins with behavioral therapy, and that's the lifestyle changes. And the lifestyle changes, again, a very common misnomer across the board in urology is that any problem with urology, drink a lot of water.
Yeah.
And it's a WhatsApp gyan, unfortunately, where people think that you drink a lot of water, it is kind of flushing your body, cleaning your body, which is all nonsensical. So overdoing any good thing, even overdone, is bad.
Yeah.
So the first thing we tend to do is to reduce their fluid intake. A lot of people drink, they are going frequently, they're drinking more water. So you have to restrict the fluid intake.
No, there are people who I know and they're like, we are urinating a lot. I think that means we are very healthy and we are energizing and rejuvenating ourselves.
So that's a misnomer and that's a myth. So they need not overdo that. So the fluid volume has to be restricted, and also the kinds of fluids. All beverages, tea, coffee, of course alcoholic drinks would have to be restricted.
Yeah.
Then if they are constipated, they need to make sure that, because if the colon is loaded, it will keep irritating the bladder and they will become worse.
Yes.
So, and of course, control the body weight, be healthy, have a regular workout.
Yes.
So keep your body weight in check, fluid intake in check, certain fluids in check. So these are and of course, we tend to tell them timed voiding so that they don't land up in a situation where they have to rush toward the washroom. So they can say they know they will have, so every 3 hours, 2.5 hours, they just go and pass urine.
Wonderful. It was very amazing having a word with you.
Thank you.
Thank you so much.
Thank you. Okay.
Wonderful.